If you never want to get pregnant again, I suggest you get the IUD because you will never want to have sex again.
Oh, I wish I could, but I don't want to.
So I'm going to talk about my IUD experience. This is just my personal experience. This is kind of based off of what the IUD information is on the internet, what I've been told by my OBGYN, and how I feel about it. I originally had an IUD placed in 2018. I was 24. I had been recently married, didn't like the birth control pill. It made me just passive aggressive and I was an emotional wreck. Can you relate to that? Anybody that's been on the pill before? And so I decided I was gonna get the IUD. And I never really thought about it at the time because I only had the IUD in for about 8 months, but looking back, I'm like, oh, that's why I felt so terrible. That's why I was sleeping all the time. I thought it was because I was working hard and the hospital was just wearing me out and I just didn't feel good and I never wanted to have sex with my husband even though I was a newlywed. But at the time, I didn't really think about it. I had the IUD removed so that we could get pregnant, and I did. I got pregnant. I had my first baby in 2018 in August, and then I breastfed. And then when he turned 1, we decided we were gonna get pregnant again, so we did. And after that, I breastfed him.
Well, don't forget to mention, we like to have a lot of sex while you weren't.
Yeah. That's my husband manning the camera. So when I was pregnant and when I was breastfeeding, it was like, oh, I actually like my husband. I don't have the IUD in. It's easy to get pregnant. We didn't have any trouble, which a lot of women do. I mean, that's why we have the Get Pregnant Guide on my channel, because a lot of women struggle to get pregnant and they've been on hormone therapy, they've been on the pill, they've had the IUD, and they stop taking the pill or get the IUD removed and then they can't get pregnant. And so we do have a lot of information for that. But I didn't have that problem. We got pregnant super easily.
I had my first baby, then I breastfed, got pregnant again, breastfed, and then I got pregnant with my twins.
And then as soon as they were born, my husband and I decided we did not want to get pregnant again for a while. While I was breastfeeding and 6 months postpartum, my OBGYN put the IUD in and I had the Mirena placed. Again, I didn't really realize what was going on until about a year later, and I was looking back on the past year when it was supposed to be a beautiful time with my new babies, my twins. I'm breastfeeding, I'm loving life, but yet month after month in my journal, I was depressed, I had anxiety, I was having suicidal thoughts, I was having palpitations, I just was an emotional wreck, and it was getting really bad to the point where my obstetrician said, okay, maybe your estrogen is just out of balance, you're super thin, let's put you on some estradiol, some compounded estrogen hormone therapy, this cream that's hopefully going to balance your hormones a little bit. And when I started taking the cream, I got better. I felt so much better. But now I have the Mirena, and a lot of people actually had very different symptoms than I was having when it comes to weight gain. I was having weight loss, and it wasn't that I was having estrogen dominance, and the estrogen cream helped. But now I have the Mirena releasing hormones into my body, a synthetic hormone, and then I'm also using this cream. And as soon as I stopped the cream, I just went back to my normal depressed, suicidal self. And I knew that something had to change. And so I had my IUD removed a year after it was placed, and I got better. Just some things that I've kind of gathered through my research. The Mirena is a hormonal intrauterine device. So it is a T-shaped plastic frame that is inserted into the uterus, where it releases this hormone progestin. It is supposed to provide long-term birth control, as we all pretty much know about the IUDs. This progestin that's being released, we think, oh, it's gotta be this normal hormonal thing, it's created in a lab, but it's just like what's in our body, right? It is the levonorgestrel releasing system. Now, Mirena has a very high dose. That's not releasing it all at once, it's releasing it a little bit at a time so that you can keep it in for 5 years, maybe even longer for some people. The reason that people love it is because it's super effective, right? We hear, oh, it's 99% effective. You're not going to get pregnant and there's really no side effects and it's going to be great. You don't even have to think about it when you have sex. Planned Parenthood, this is what they say about it, is progestin is a safe synthetic form of a hormone called progesterone that your body makes naturally. But The problem is it's not really natural. We use this term progestin or levonorgestrel, or it's like progesterone, and it's going to do exactly what your body does, but it's not natural. It's not even like natural. I mean, it's a drug that's being released in our bodies. And I think as women, we think, I mean, I'm a culprit as anybody is. And I think, okay, I want to change one thing without it changing the whole system. But that just can't be done. We know that with our bodies, that we change one thing and it's going to have effects on every part of our body. And I really experienced that. It made my life hell when I should have really been enjoying my first year with my newborn twins. And I did read this from George Gilson. He is a MD, so a medical doctor, and he's PhD. I wish that for the benefit of our patients, we in North America would learn that progesterone is progesterone, physiology is final, and the truth is that synthetic progestogens are not appropriate substitutes for our own progesterone. But that's how we talk about it. We say, oh, the IUD, it's progestin, it's this normal, very natural-like hormone that we're going to put in our bodies, and all it's going to do is prevent pregnancy. That's all it's going to do, and it's going to make your life so easy. Now, if you want to look at the big picture and think, okay, pregnancy is absolutely out of the question for me, I can't get pregnant, then you are going to have to weigh those for yourself. But just know that it is going to change your life. It's not going to just be the simple thing, a T-shaped plastic device releasing this hormone into your uterus, and it's such a small amount, it's not going to affect the rest of your body. Because that's what all of these physicians are telling us, is that it's only going to stay in your uterus. It's not going to affect any other part of your body. And that's just not the experience that a lot of women have with it. And I know that I'm not alone in this, but I know that there's a lot of women that feel like they're alone and their doctor's telling them they just don't know what they're talking about. Maybe something else is imbalanced in their life, and that's why they're feeling this way. I want to go back to the side effects that actually are mentioned when you get the IUD. It's probably in the pamphlet. You might just not have read it, or maybe you're not actually believing that it could actually happen because they say it's such a small likelihood of it happening. Bleeding. And when they say bleeding, anything you can imagine could happen with the IUD. You could have an absent period, missed period, or irregular menstrual periods. Longer or heavier menstrual periods, bloating, stomach, pelvic spasms, or pain. You could just have absolutely no bleeding at all. Unusually heavy or unexpected bleeding, uterine bleeding between menstrual periods, vaginal bleeding, or spotting. That's a lot of variations of bleeding, and maybe not a huge deal. For a lot of us women, we're like, okay, whatever, like I'll just carry pads with me wherever I go, not a huge problem. But let's go on about the side effects. You could possibly have ovarian cysts. Now, I know just by my own personal feelings that I did have cysts when I had the IUD. It's very painful. Now, if you don't know what it feels like, if you're having pain and you go into your OB's office, they're probably going to do a sonogram and say, okay, yeah, you're having some ovarian cysts. They'll resolve on their own, most likely. Nausea. Now, me personally, I didn't want to eat while I had the IUD. I was a busy mom and food just made me nauseated when I would eat. And so that's why I think I was losing so much weight, even though weight gain is usually what women say that they experience with the IUD. But I just did not want to eat because food made me nauseated. Headaches, yep, I experienced migraines with the IUD. I'd never had migraines my entire life, and I was having migraines. Acne, now that wasn't a side effect. I experienced really dry skin, like flaky skin. No matter what I did with my moisturizers, I was having terribly dry skin. Breast tenderness, mood changes, yep, I experienced that one. I had terrible mood changes. I was suicidal. I was having anxiety, panic attacks, could hardly sleep at night because I just felt like I was going to die, or my children were going to die, or somebody was going to die. And infection, oh yeah, I didn't know that this was a big one until my research. Bacterial vaginosis you're at an increased risk for it when you have the IUD. And then this one, ectopic pregnancy, is something that I think a lot of us know, that you can actually get pregnant with the IUD, but it could possibly be an ectopic pregnancy, so somewhere outside of the uterus, possibly the fallopian tubes, and you could die from it if you didn't seek medical help. And then a perforated uterus. So the IUD could actually move outside of its normal healthy area of the uterus and perforate the uterus, and you could never have babies again. So pretty big deal. Not a huge number of women that are having it happen to them, but could still happen. Lastly, want to talk about the Mirena Crash, because I think a lot of us, when we are reading about this kind of stuff, we hear women saying, well, if you have the IUD removed or the Mirena removed, then you can experience terrible symptoms because of this hormonal imbalance. Your body got used to this drug that was in your body for all of these months, and then you're going to experience all of these terrible symptoms. And the terrible symptoms are all of the things that I just mentioned that you could have happened with the IUD. And so for me, I did not experience a Mirena crash because for me, I was already experiencing them for all those months that I had the Mirena. And when it was removed, I actually had some bleeding right away. So I started my period right away. I bled for about 3 days, and then I felt amazing for about a week. And after that week, then everything started to kind of get cloudy again, and I started to feel those symptoms that I was feeling with the Mirena. Now, those only lasted for me for about 2.5 months, and they were not as severe as when I had the Mirena in. And so now I am past my 3-month mark of having the Mirena removed. I am very happy about it. I'm so glad I got that thing out of my body, that drug that was being released very slowly. And my husband and I have had to figure out a different way to not get pregnant. And so for you, I know that's gotta be a big decision, but I just wanted to share my experience with you that you are not alone if you have an IUD or if you're thinking about an IUD and you're concerned about some of these things. I hope this was helpful. Please let me know in the comment section if you have any questions or you want me to clarify anything, and I will see y'all in the next video.